Hello, everyone, and welcome. I'm excited to kick off today's presentation on a very special topic. We're going to explore a step-by-step guide on taking care of your 1-month-old baby. The focus is on essential tips for new parents, helping you feel more confident and prepared during this precious early stage. Over the next few minutes, we'll cover key aspects of newborn care, from feeding and sleeping to health and safety. So, let's get started and make this journey a little easier and more joyful for you. Now, let's take a closer look at what a 1-month-old baby really needs. At this stage, they're sleeping a lot, typically between 14 and 17 hours in a 24-hour period. It might seem like they're just resting all the time, but that's actually essential for their growth and development. They also need to be fed frequently, usually every 2 to 3 hours. This means that their tiny stomachs can't hold much at once, so regular feeding is crucial to keep them nourished and happy. On the social side, even at just 1 month old, bobbies are starting to recognize voices and faces. They might not understand everything yet, but they're already beginning to form important bonds and become familiar with the people around them. Connecting all of this to the bigger picture, understanding these needs helps us ensure they're getting the right care and creating a nurturing environment for their growth. It's all about meeting them where they are and supporting their natural development during this vital first month. Now, let's talk about the first step in caring for your baby: feeding. It's important to remember that newborns typically need to be fed every 2 to 3 hours. This frequent schedule helps ensure they get the nutrition they need to grow and stay healthy. After each feeding, make sure to burp your baby gently. Burping helps release any air they might have swallowed during feeding, which can prevent discomfort and fussiness later on. As you're feeding your little one, pay attention to their cues. One key sign that they're full is when they turn their head away or stop actively sucking. Recognizing these signs is crucial because overfeeding isn't helpful and can be uncomfortable for your baby. So, by keeping these points in mind, feeding every couple of hours, burping after feeding, and watching for signs of fullness, you're setting a strong foundation for your baby's health and comfort. This step is fundamental as it directly impacts their growth and well-being, tying into the overall theme of nurturing a happy, healthy baby. Now let's talk about step 2, establishing a consistent sleeping routine. First, it's really important that bobbies sleep on their backs. This position has been shown to significantly reduce the risk of sudden infant death syndrome, or SIDS, so making it a standard practice is key. Next, consider swaddling if your baby seems to need a little extra comfort. Swaddling can help them feel secure and promote better sleep, but always ensure it's done safely. Nothing too tight and always leaving room for hip movement. Lastly, keep the crib toy-free. While it's tempting to add some toys or mobiles, they can pose a safety hazard or distract your little one from safe sleep. By following these steps, you're creating a safe, calming environment that supports healthy sleep habits, which ties directly into our overall goal of promoting your baby's well-being and development. Now, moving on to step 3, which is diaper changing. It's important to change your baby's diaper regularly, ideally every 2 to 4 hours. This helps prevent discomfort and reduces the risk of diaper rash. When you change the diaper, make sure to clean the area thoroughly and dry it well. Proper cleaning and drying are key to maintaining good skin health. If your baby is prone to rashes, applying a gentle diaper cream can provide a protective barrier and soothe irritated skin. Remember, consistent and careful diaper changes are essential for your baby's comfort and overall skin health. This step ties into our overall goal of keeping your little one happy, healthy, and comfortable. Now let's talk about bathing your baby, which is a wonderful opportunity to keep them clean and comforted. It's recommended to give your baby a sponge bath about 2 to 3 times a week, especially in the early days before the umbilical cord falls off. When you do bathe them, use warm water, just comfortably warm, not hot, and a soft, gentle cloth to clean their skin. This helps prevent irritation and keeps their delicate skin safe. Remember to always support your baby's head and neck during the bath, as they are still very fragile and can't hold their head up on their own. Supporting these areas not only keeps your baby safe, but also makes the experience more comfortable for them. Bathing can be a soothing routine for your baby and a special bonding moment for both of you. Just keep these key points in mind: gentle water, soft cloth, and proper support, and you'll be well on your way to making bath time both safe and enjoyable. Now let's talk about step 5, holding and carrying. When supporting a newborn, it's crucial to always support the head and neck because their muscles are still developing and can't do that on their own. This helps prevent any injury or strain. Next, it's important to avoid sudden movements. Bobbies are very delicate, and quick or jerky motions can startle them or even cause injury. Gentle, smooth handling is always best. And if possible, try to have skin-to-skin contact. This not only promotes bonding, but also helps regulate the baby's temperature and heartbeat. It creates a sense of security and comfort for the newborn, which is essential in their early days. Remember, these points fit into our overall goal of providing safe and nurturing care. By supporting the head, moving gently, and fostering skin contact, we're helping to ensure the baby's safety and emotional well-being from the very start. Now let's talk about step 6, calming a fussy baby. When your little one is upset, there are a few key strategies you can try. First, offering a feeding or a gentle burp can often do the trick, especially if hunger or gas is the cause of fussiness. Swaddling your baby snugly can also provide comfort and a sense of security. Next, gentle rocking or using white noise can help soothe and calm their nerves. These gentle motions mimic the calming sensations they felt in the womb, which can be very reassuring. And don't forget to check the diaper. Sometimes discomfort from a dirty or wet diaper or gas buildup can make a baby fussy. All of these steps are about tuning into what your baby needs at that moment. Remember, calming a fussy baby is a vital part of the overall approach to nurturing and understanding your child's cues. It's about creating a comforting environment so they feel safe and secure. Now let's talk about step 7, baby hygiene and skin care. Taking care of your baby's skin is essential for their comfort and health. One important aspect is wiping their face and skin folds daily to keep them clean and dry, which helps prevent irritation and rashes. When choosing products, opt for gentle, scent-free options. These are less likely to cause allergies or skin sensitivities. Also, don't forget to clean the umbilical stump carefully. Keeping it dry and clean promotes healing and prevents infections. Remember, establishing a gentle and consistent hygiene routine supports your baby's overall well-being and builds good habits early on. Now, moving on to step 8, health monitoring. This is such a crucial part of caring for your little one. First, you'll want to keep a close eye on basic things like their weight, sleep patterns, and feeding habits. Tracking these can give you valuable insights into their growth and how they're doing overall. Next, it's important to monitor more specific signs like breathing and temperature, especially if your baby shows any signs of discomfort or illness. These are key indicators of their health status. And of course, regular visits to the pediatrician are essential. These checkups allow professionals to assess their development, catch any issues early, and give you peace of mind. Remember, consistent health monitoring ties directly into the overall theme of nurturing and safeguarding your child's well-being. It's about being proactive and attentive, ensuring they stay healthy and happy as they grow. Now, let's talk about when it's really important to reach out to a doctor. First, if your baby develops a fever over 100.4 degrees Fahrenheit, that's a clear sign that medical attention might be needed. Fever can indicate that the body is fighting off an infection, but it's also a signal that something more serious could be going on. Next, if you're noticing that your baby is having difficulty feeding or breathing, don't wait. Call the doctor right away. Struggling to feed or breathe can be signs of respiratory issues or other health concerns that need prompt evaluation. And finally, pay attention to unusual crying. If your baby is crying more than usual or in a way that seems different, perhaps more intense or inconsolable, that's another sign to seek medical advice. Remember, these signs are important indicators that your baby may need professional care. It's always better to be cautious and check with your healthcare provider if you're unsure. These guidelines help us catch potential issues early and ensure your little one stays safe and healthy. All right, as we wrap up, I want to leave you with some final tips and encouragements. First, trust your instincts. You know your child best, so don't second-guess yourself. Your gut feeling is often right. Second, remember to share duties with your partner. Parenting is a team effort, and working together makes the journey smoother and more rewarding. And finally, consider joining parent groups. Connecting with other parents provides support, shared experiences, and great advice that can really make a difference. These tips are all about building confidence and creating a strong support network, which ties back to the overall theme of empowering you as a parent. So, stay confident, collaborate, and seek community. You're doing a great job. If you found this video helpful, I really encourage you to like, comment, and share it with your family and friends. Your support can make a big difference in helping others on their own journeys. Remember, sharing knowledge spreads empowerment. And don't forget to subscribe to our channel, Step by Step 2030, for more easy-to-follow guides that are designed to inform, empower, and truly care for your loved ones. Following us on YouTube and engaging with our content ensures you'll never miss out on practical tips to help you and those you care about navigate challenges confidently. Thanks so much for being here and for your support.